Come back or stay in some cases for our afternoon or health presentations this afternoon. As you can see, they are topics we haven't dealt with previously. So totally new topics, not even close. Physiotherapy and dental health. And you probably think you know everything about some of them, or both of them, and you may be surprised what you don't know. Well, no, we'll see. Our presenters today, two actually lovely young ladies. One is Elfida and Nelifa. Yay. So, I did actually, that's one. I'm so proud of myself. So, first of all, will be dental health and followed by physiotherapy. So we're going to start with a word of prayer. And not wasting more time after that, I'll invite Elfida to come up and she'll start her presentation. Let's bow our heads. Our Father who art in heaven, thank you for the opportunity to learn. And we're always learning, there's always things new. Pray, Lord, that this time you be with the presenters and guide what they'll say, how they'll say it, so that we'll all leave here today knowing something a bit more than what we did when we came in. It's my prayer in Jesus' name. Amen. And just before I start, I just want to welcome some faces that are unfamiliar to me. Young lady sitting next to Emma. Sharon. Hello, Sharon. Welcome to Dagenham, Clacton Church. And we have some visitors at the back. Don't be shy. Hi. Hope you enjoy the program that we have on for you this afternoon. Nelifa? Yeah. Yep, stage is yours.
Yeah, thank you very much. Right, we're going to talk about teeth today. Okay. You brush your teeth? Twice? Good. Right, so my name is Elfida Tilquerido. I'm a dentist and I work here locally in Clacton. Okay, I'm dentist in this area for nearly 20 years. Okay, so let's start with the impact of teeth on overall health. Okay, so we need to understand how the oral health can impact the overall health, everything. Okay, so let's start. Why oral health matters? Okay, so our teeth are more than mere tools for biting and chewing. It's true, isn't it? Okay, so we have teeth they help speech articulation. So actually the teeth, together with other oral structures in our mouth, like the tongue, the lips, the mucosa, soft palate, hard palate, floor of the mouth, okay? So they help to create a spectrum of sounds, okay? And the placement of the teeth is also effective, so we can succeed speech clarity and allowing effective expression. So definitely, without teeth, we can't speak very, very well. Sometimes you remove one tooth and poor people, they suffer forever. Okay, so facial support and aesthetics. Definitely we need teeth, otherwise our face, it looks a little bit sagging, Okay, so we make sure if we lose teeth, we try to replace them either with implants, dentures, or most important, try to preserve your own teeth. The best option, yeah? Jawbone density. Okay, so if we lose teeth, what is happening after a while? What's happening? Did you ever come across to this? Your bone? Recede. Okay. So, as long as we have, sometimes if we have like root canal treatments, the dentist says, leave the tooth, leave the root there. Why? Because if we remove it, eventually, we'll lose bone. It will deteriorate. So we prefer, if it is asymptomatic, to keep it there. All right, but the point is, don't lose your teeth, so we maintain a nice, healthy bone. Okay? So digestion and nutrient absorption. Of course, chewing initiates the digestion, okay, breaking down the food, and of course, without the saliva, we wouldn't be able to swallow. Okay, saliva also contains a lot of enzymes that they help the absorption of the nutrients. Okay, so let's move on. Oh, beautiful smile. I bet somebody here has a better smile, like this beautiful girl. Shy. Right. So there are studies, the last many years actually, but definitely recently, okay, that they prove to be true that any problems in their mouth, they can be connected with other systemic health issues, okay, like cardiovascular issues, diabetes, all of them are connected. So, bacterial transmission, oral pathogens or bacteria, okay, and their byproducts, so they can enter bloodstream through the mouth, potentially spreading to and affecting other organs. So what happens? If the mouth is not healthy, if you have an infection, an inflammation, that can go to different organs in your body. This is why sometimes people that are due to have like heart operations, they have problems with their heart disease, okay, always they need to come to the dentist first before the surgeons that will perform any type of surgery, okay, because we need to make clear that the mouth is free for any infection and inflammation, otherwise it's dangerous, okay? So systemic inflammation from oral diseases like periodontitis can lead to an increase in pro-inflammatory markers which can circulate throughout the body and contribute to systemic inflammation. What that means is that if we have an infection in our mouth, okay, like gum disease, gingivitis, are you aware what is periodontitis or gingivitis? Right. When we have poor oral hygiene, okay, or the immune system of some people is quite low, and at the same time their oral hygiene is not very well, or they can suffer with diabetes or heart disease, okay, they can contract quite easily different types of bacteria in their mouth, you know, if they don't clean their mouth very well, so they have constantly an inflammation. All of this that can affect the body, the heart, the liver, you know, everything, and vice versa. So it's not only one way, it's two ways, the problem, okay? So let's continue there, and let's be a little bit more specific. Cardiovascular disease, okay. So there is an increased risk of cardiovascular disease, heart disease, okay, particularly individuals with periodontitis. Periodontitis is infection of gums, the bone, when the gums recede, when the bone recedes and the teeth, they start getting loose, okay? So bacteria from the mouth, from the gum disease, they can enter the bloodstream and that can affect the heart, all right? Diabetes. People with poor oral hygiene, all right, definitely, and they suffered already, they're diabetic, okay, they found it very hard to control the sugar in their blood. So specifically, people that they suffer with diabetes, they need to be very careful with their oral hygiene. And they heal very quick, very late, sorry. It's more difficult to heal after having an extraction or an operation in their mouth, all right? And they can develop gum disease or periodontitis quite easily. Adverse pregnancy outcomes. Unfortunately, the periodontal disease can affect the birth, the pregnancy, the baby during the pregnancy. So you can see premature birth and low birth weight, okay? It's like the smokers. You know, you can see that they can affect the baby also, right? Respiratory infections. You swallow the bacteria, they affect your lungs, and you can develop pneumonia and other respiratory issues. So sometimes you don't expect that it can be so serious, you know, if you neglect a little bit your oral hygiene, but it can become really serious.
And you must be careful who you kiss.
Absolutely. No, definitely. I totally agree. Yeah, you don't know what is the mouth of the other people. Yeah, even, this is why never share toothbrushes, because I heard sometimes people, they share toothbrushes. It's like they exchange bacteria, okay? It's not healthy to drink from the same glass, you know, sometimes, especially people that you don't know. So be a little bit aware, okay? Other diseases also, yes. Associations also have been found with conditions like Alzheimer's disease, rheumatoid arthritis, and of course cancer. All right, cancer that it's related also not only in the mouth, gastrointestinal and colorectal cancer, which they are thriving the last few years. Okay? Right, this is a little diagram. Okay, whatever I said, it's there. Okay, so you can see the bacteria and other toxins, they can enter your circulations and then they can spread all over your body. Okay, give a little bit more attention to the heart, to the liver. Okay, and as we said, periodontitis gum disease now is linked to a variety of other conditions like heart and lung disease, Alzheimer's disease, stroke, diabetes, cancer, obesity, and premature birth. Right, now, how systemic health impacts oral health? Now we go opposite. Before we said how oral health impacts systemic. Now we go to the opposite, okay? So shared risk factors. Conditions like diabetes and obesity are linked to both systemic diseases and poor oral health. Okay, so people that they suffer already with obesity, diabetes, or even heart disease, they are prone to, if the oral hygiene is good, to develop some kind of oral disease, okay? Exacerbation of oral disease, systemic conditions also can influence the development and severity of oral diseases. So if already you're ill for, like you're diabetic or you have problems with your heart, okay, so it's quite easy to develop one of these two conditions. Oral manifestations, that's very interesting because I have too many patients are coming. It's with sores in their mouth, ulcers in their mouth, you know, they're complaining that they persist. Sometimes it's difficult to get rid of them. The first thing that we say to them is, go and have blood tests, because an underlying problem with from a different system in your body might be the issue. So from the mouth, we can investigate quite early other issues in our body, okay? Liver, blood sugar levels, okay? If somebody is diabetic and doesn't even know it, okay? Immune response. So systemic diseases can provoke an immune response. Of course, when we get ill, okay, suddenly our body try to fight it, okay? And that affects also the oral tissues, yeah? Now, let's understand a little bit our teeth, okay? Basic anatomy. So you can see it's like I have a tooth there and I slice it in the middle, okay? So the top coat is the enamel. It's the white bit that you see on your teeth. It looks lovely, nice, strong. Protects the tooth, okay? Bottom below is the dentin, which is yellow-orange, and it's a little bit softer, okay? In the middle, in the core of the tooth, is the pulp, which is the space with the nerves, the vessels. This is where it hurts a lot if you are naughty and you don't clean your teeth, okay? And then we have the gingiva, with simple words, the gum, and below is your alveolar bone, your bone. Okay, so gingiva, when it's nice and healthy, it's nice pink, baby pink, and it's nice and firm around your teeth, so, and it doesn't bleed. But if you start seeing that it starts getting a little bit soggy, start bleeding a little bit, hurting, that's the first sign of gingivitis, okay? So that means that you need to start improving a little bit your oral hygiene. We'll say how later on. If you leave it as it is, it will get worse. Then it will start affecting your bone. So your bones start receding, your gums start receding, and these poor teeth, they will start dancing in your mouth. Okay? All right. So common dental problems. What is the first one? Decays. Oh, I'll tell you what, we see this, probably 20 patients. I see about 35, 38 patients a day. The 20 of them are coming like that. And there is no age limit. It can start from 4 years old and it can go up to 90. And I mean it. I had a 7-year-old about 3 months ago, and it needed only baby teeth. He had only 2 permanent teeth, needed about 9 fillings. And we see that every single day. What has caused that? Right. I believe that it's education. From the house first it started, doesn't it? I mean that the parents, they need to encourage the children to have a good oral hygiene, to brush their teeth twice. Most likely they don't. The second thing, what can it be? Diet, poor diet. Too many sweeties, fizzy drinks, okay? Which in my opinion is neglect, isn't it? Okay, because usually the kids, you have to make them do things, you know, they don't think to do it. You have to do that. I used to drag my daughter in the bathroom to brush her teeth. They don't like it. They're children, but we have to do it, okay? But the good thing is to explain them, to read them, to show them why they have to maintain nice teeth, okay? So, caused by bacteria, an acidic, erosive diet, okay? So, poor oral hygiene combined with acidic, erosive diet, these are the results, okay? And sensitivity, pain, and quite often, loss of the teeth. Now, we talk about gingivitis and periodontitis, so now you can see a little bit better. Okay, no worries, thank you, thank you. So, the first picture up there is gingivitis, which is really infection of the gums. What is the main reason again? Poor oral hygiene, we don't brush, okay? So, this is an unhealthy mouth. The bottom is a healthy mouth. You can see the difference. The bottom, can you see the gums? They look nice, firm, pink. Look the top one. All right, quite red, quite inflamed, swollen, all right, and of course bleeding. But I have to make a little note there. The top picture, usually you can see people in my surgery that they're coming because they don't follow guidance, they don't brush their teeth, okay, they're a little bit lazy. But I have also cases, people that they look after their teeth, but unfortunately they suffer with different types of illness. For example, people with epilepsy, they take medications, and the medications, they have side effects, bleeding gums and swollen gums, okay? So it doesn't mean we can't criticize everyone, you know, it's not fair. Also, blood pressure medications, some of them, they can have side effects like bleeding gums, okay, or swollen gums. So we need to take, before we speak to the patient, we need to ask and we need to take consideration everything, okay? All right. So, gum disease, as I said, it's gingivitis or it is periodontitis. So periodontitis is much, much more severe, okay? So you can see a mouth here, obviously it's not clean, okay, it's discolored, moderate stage. So we see that very often in the surgery, all right? So severe inflammation of the gums, but in that case also the bone underneath recede, and slowly, slowly, the teeth, they start getting loose. You can see there deposits of tartar, of plaque, of bacteria, and in the end they lose their teeth. The problem is that some people that come in, they say, it's okay, at the end of the day, Elpida, I'm going to lose my teeth, I'm going for implants. And I said, yeah, but implants are not easy. Implants is not for everyone, okay? And to place an implant, I need to have a bone. If you don't have enough bone, I can't do it. So most of these people end up with dentures, okay, at the end. So, and they don't like them, they hate them. Right, and let's go here now, which is very interesting. I know it's not very pleasant, but unfortunately, cancer in the mouth is thriving. Okay, the last 3 years, I can see probably every 2-3 days at least one case. Okay, so oral cancer, it's a type of head and neck cancer, and that can affect your lips, your tongue, everything. Hard palate, soft palate, throat, okay? And the main symptoms usually is if you see a little sore. It doesn't matter how small it is. When we talk about cancer, don't expect to see something, suddenly something massive, something tiny. Even if it is tiny, you need to check it, and especially if it doesn't hurt. Okay? All right. So, the first symptoms, as I said, it's sores that they don't heal and red or white patches. Okay? The risk is increased, of course, people that they smoke and they have too much alcohol. All right? And of course, it's very critical early detection because the treatment definitely it would be more successful, although the treatments in the mouth cancer are quite difficult. Okay? Most of the times is surgery, then radiation or chemotherapy, but most of the times you end up with surgery. So, maintaining good oral hygiene. After what you see, definitely you want to brush 3 times a day, not twice. Okay? Floss daily. Very, very important to floss. We start flossing, I did it, I want to be honest, and sometimes we're getting tired and lazy, okay? But we need to floss every single day. If you don't like floss, use the little dental brushes, or we have the water pick floss, which is good. It's a little bit ridiculous the first time because it looks like you have a big shower, but you will get used to it. But it's very important because you clean everything in between your teeth, something that you can't do with a toothbrush only, okay? Mouthwash. Now, this is a debate with lots of my colleagues, Mouthwash, I always advise my patients 2 or 3 times a week, not every day. I think it's wrong to use mouthwash every day because it's still chemical, isn't it? Okay, and definitely it can affect the soft tissues in your mouth. The same time, in your mouth, you have different types of bacteria, good bacteria, bad bacteria. So if you use mouthwash every day, what are you doing really? Nothing. It's like antibiotics, okay? When you take them for the wrong reason, they stop to be effective, okay? So mouthwash, if you have an infection in your mouth, you can use it. You can use salty water also, okay? But if you really want to use it, in my opinion, not more than 3 times a week, okay? But make sure you brush well 2 a day and floss. And of course, regular checkups, you saw why. Most of the cancers, we find them, they don't even have a clue that it's there, okay? Prevention, yeah? Diet and oral health. So, yeah? Sorry, about? Right. Don't worry.
I just wanted to ask, how do you brush your teeth and what type of brush is best to use?
Right. We recommend definitely medium or soft. People that they suffer with sensitivity, I will advise soft toothbrush, okay? Always use toothpaste with fluoride. Fluoride helps your teeth, reinforce your teeth, make them stronger. And especially most of the people after 50s, I put myself in, we do suffer with sensitivity, okay? Because we have a little bit of tooth wear as we're getting older, okay? So we need something to protect our teeth. So we always recommend toothpaste with fluoride, any brand. I don't want to make an advertisement here. It doesn't matter if it is Oral-B, Colgate, I don't care, okay? And soft or medium toothbrush. Hard toothbrush, it was very much in fashion about 20 years ago because we thought that we make our teeth whiter, but in reality, we made them more yellow because we were rubbing the enamel off and we're pushing, we made our gums to recede. The way that you brush your teeth, I will advise you if you don't use electric toothbrush and you use only manual, which is fine, circles. So you start circles from your gums towards your teeth, from your gums towards your teeth, okay? And never forget all over. And incisal, never forget to brush your teeth and all your mouth very gently, even your tongue at the end. It's very important to brush very gently your tongue, okay? The other thing that I will advise you is don't rinse out straight away. Just spit after 30 minutes. You can gargle with salty water or water, because leave the fluoride to work a little bit on your teeth, especially if you suffer with sensitivity. Okay? Right. So, regarding the diet, limit sugary foods and drinks. Okay. Why? Sugar feeds bacteria that cause tooth decay, and also we do know now that sugar encourages cancer. Cancer cells, they love sugar. They have a sweet tooth. Okay? Second, eat balanced diet. Include fruits, vegetables, and dairy for essential nutrition. Right. The only stop that I will do here is regarding the fruits. Dairy are good, okay, because we have calcium. Vegetables, definitely good. They don't have sugar and stuff like that. They're very healthy. But fruits, they're acidic and they have a lot of sugar. So you will have fruits, but moderate, okay. I had a patient the other day, she said, I can't live without oranges. I eat about 8 oranges a day. I said, you have to live only with 2 or with 1. What can we do, you know? Okay. And of course, stay hydrated. It is very important to drink a lot of water. Okay, at least 2 liters of water a day, because it helps to wash away all the food particles and keep saliva flowing. Healthy food, unhealthy food, nice body, big body. Okay? As I say to my patients, if you look after your teeth, they will look after you. Easy as that. Conclusion. Right, maintaining good oral hygiene prevents oral diseases, okay? Leads to better overall health, improves quality of life, and boosts self-confidence, because of course it's nice when you smile and you have nice teeth. I have people that they come and we do a lot of work in their mouth, and bless them, they come and they're like that, you know, and when we finish the work and give the mirror and say, come on, smile, give me a big smile, and they can't do it because they didn't get used to it, you know, so it takes time to bring themselves where they were 20 years ago, all right? And this is a lovely, lovely smile for a little girl and a lady there. So thank you for being an amazing audience. Any questions at all? Tell me.
Can you tell us something about the teeth whitening craze that's going on?
Right. This is not something new. It's something that the last 20 years, people, they love it, okay? The best advice that I will give you is just be careful where you will do it. Yeah, we do cosmetic work, we do tooth whitening, but we have to take into consideration a lot of factors, okay? The age of the patient, if the diet of the patient, if he's a smoker or she, okay? And of course, the product that we will use. Usually, for tooth whitening, you use peroxide, but by law, it needs to be around 6%. You can see that there's, I don't know, on the internet you can find some crazy numbers, 32%, 16%. Just be careful, because you can damage your teeth. And if you decide to do it only with a professional dentist, okay? I saw people about 7, 8 years ago, it was very much in fashion, the whitening that you said. And even hairdressers, they used to do it. I have nothing against hairdressers, okay? But they used to do it in their salons. And I had people, not only me, and my colleagues coming back, and they said, they're so sensitive, I can't even talk because the air touched my teeth, and they were in tears. What can you do to treat these people? Very, very difficult, because sensitivity is extremely difficult to treat. It's difficult to bring your teeth like it was before. All I have to say, because I do whitening, is I will do it only if I feel that it's a case that affects mentally my patient, okay, and it's something severe, but something that it's still okay, I can't see any reason why you have to do it, most likely I will say no, okay? And if they want to do it, they can go somewhere else. But first you need to protect them.
So you're saying to brush your teeth twice a day. So you think first thing in the morning, last thing at night.
Yes, this is the normal route, okay? But usually we say, I'll tell you now, I know what you will say now, before or after breakfast. I know what you will. Unfortunately, life is too quick, okay? So when you rush to go to work, or when you have to rush to get the kids to school, okay, you can't tell them eat your breakfast and then brush your teeth, because most likely they won't do it, okay? But still we say, morning time, you need to find either before or after breakfast, it doesn't matter. For me, the most important is nighttime before they go to bed. And believe it or not, all my patients are absolutely lovely. I know them all one by one the last 20 years, but sometimes I still ask patients, how many times do you brush your teeth? And we talk about my age, a little bit older, once. I said, why do you brush them once? And they're retired, most of them. You know, you have time to brush them, because, you know, you're not going to work. It's a habit, twice a day. And even if you have time, lunchtime, after lunch, do it. Yeah? Yeah?
Can you tell, as a dentist, can you tell if I've not brushed it twice a day?
Haha, that's a tricky question. We can, because if you do it only once or twice, we can't. But if you don't brush your teeth, that will be all over your mouth. We can see the deterioration of your gums and your teeth, so we can understand if you brush them or not. I mean that I have patients, they brush them really well about 30 minutes before they come. I can see, because they brush them so hard, and you can see they make the gums sore. But you know that they're not very good, their oral hygiene. You can see the eyes when they give you the answers. So, cheeky ones.
Can you explain about interdental brushes?
The interdental aids.
Brushes.
Brushes, okay. The interdental brushes are quite easy. I'm so sorry, I should put them here. It's like little brushes with a plastic handle, you know, and they have different sizes, okay? So the pink one is the thinner one, then they go orange, they have, you know, blue, yellow. It depends how big are the gaps in between your teeth. I would say you need to use them every day, and the very good tip I always give to my patients is dip them in the toothpaste. So brush your teeth, dip it in the toothpaste, and go and clean in between once a day. They can be a pain sometimes because they can bend, okay? In that case, they can have the TP, it's like plastic points. I think that these are better, especially the orange ones, you know? Otherwise, floss. Okay. Any other question? Yeah?
My dentist say I should come to visit him twice a year.
Of course.
Most of the time when I go there, they check it out and then give me a clean.
Okay.
Which cost me £30.
The clean is only £30? You're lucky. You're very lucky.
So, is it really worth for the dentist to do the cleaning at £30 cost, or probably more? Or is it something that the patient themselves can do at home?
Right. I'll tell you. We have cases, the dentist is able to evaluate if you need cleaning or not. Okay. So I have patients that they're coming at the surgery every 3 months. So, for cleaning. They build up so much tartar, sometimes hardly you can see the tooth. You have to break the tartar, you know, with the scaler to see the tooth underneath. There are people that they develop tartar very easy. There are people that don't develop tartar at all. Okay. But the cleaning is not only for the tartar. even if you don't have any tartar, once a year, it's good to have a little bit of cleaning below your gum line, because that renew all the tissue, okay, and maintain a very healthy, nice gingiva. So this is why I said this is not fixed, okay? So the dentist can evaluate who needs to be seen every 3-4 months. Of course, you have the right to say no, it's your mouth. But we need to make you aware that most likely, if you want to follow, you might have this and this and this issue. And then it's up to you, okay? We can't pin you down to clean your teeth, okay? But if they say usually you need cleaning, I think that they mean it, because it's only £30. I mean that if you go to the hygienist, if you see the hygienist, they charge you about £90 the course of cleaning. But this is for other cases that they're more severe, like gum disease or periodontitis, that we definitely advise them to have some treatments to maintain their teeth as long as possible. Still, we're not gods, you know. Okay, all right. So I know what you mean, because sometimes I have patients that are coming and they think that it's not the money. It's not about the money, but if you need to have this treatment, okay, it's better to do it when you can afford. It's important. Okay. Any other question?
Yeah, about the cleaning as well, because I've seen, or on YouTube where I've seen on YouTube where people are using coconut oil and baking soda to clean their teeth, and saying that it's wonderful, it's better than using chemically,
the toothpaste.
So that's one question. And then my second question is it okay to use diluted with water, something like food grade hydrogen peroxide to rinse your mouth?
Peroxide, anyway, they sell it outside to rinse your mouth. The Colgate has a mouthwash, peroxide mouthwash, okay? But as I said, you don't use it if you don't need it, okay? I mean that I will use it if I have my gums for some reason start bleeding, or if I have an infection, or I'll give it to my patient if I have to remove a tooth that it was infected, okay? And probably I will tell them use it for the next couple of days. But if you're okay, no need to use it, okay? Now, regarding the first question that you gave me, this is up to you. Everybody, we are different, as I said, okay? So you said about the coconut oil and the baking soda. I never did it personally. I prefer my toothpaste, okay? Because it feels better after, okay? But people, they try. But I always say anything with fluoride keeps your mouth safe, keeps your teeth safe. I believe that fluoride is good for your teeth, okay? Because some people, they're scared that it can be poisonous. Yeah, it can be poisonous, but in different quantities, and all right, so all these pharmaceutical companies, they know what they're doing, I think. Any other questions? No? Lovely. So it was a pleasure to meet you. Okay. Thank you for listening. Thank you. Thank you.
Interesting? Yes. Okay, well, wait till you hear the next one. Next presenter will come up. Physiotherapy.
Hello, everyone. How are you all doing today? Doing well? Yeah? Feeling healthy? Okay, so if we talk about physiotherapy, what comes to mind? Like, what is physiotherapy? Anyone has an idea?
Pain, joints, muscles, pain.
Lot of pain.
Pain, joints, muscles,
Yeah.
that sort of thing.
Yeah, a lot of pain in it. Yeah.
Moving and handling.
Yes, that's one thing. It's good.
Backaches, shoulder pain,
Yes.
and you helping us to
Yeah.
try to work through the pain to get mobility back.
Yes, you are on point. Okay, now if we go deeper into it, as he said, a physical therapy. So it's about your physical health, how you are moving, how you are going to handle yourself, how you get backache, how to get rid of it. All of it is part of physiotherapy. But it's not only that, it has multiple branches. Do we have it on? Yes. By the way, I'm Nilofer Master, I forgot to introduce. Yes. So, as he said, joint, muscle, ligaments, bone. So pretty much that's it, isn't it? That's what we feel. But it actually has a lot of different criteria. What you explained just now is part of musculoskeletal physiotherapy. That works with your joints, with your bones, how your muscle works, how your ligament goes, how you get your ankle sprains, how to get rid of ankle sprains, how to make sure it doesn't happen again and again. All of it becomes part of musculoskeletal. The most hot topic, the posture, that's part of musculoskeletal, because everyone is worried about their posture and never knowing what is the correct posture. So that's a dilemma we are going to solve today, see how the posture works. Neurophysiotherapy. Now that is the part that I am interested in as well. Neurophysiotherapy is very deep because you are moving the body, but you are hoping an effect on your brain, that how your brain is going to operate. And that has also part of pediatric physiotherapy. So for kids with Down syndrome or other neurological condition like autism and multiple sclerosis in some cases, the pediatric one. So a lot of those cases, that's where physiotherapy comes in action as well. And how it works with it, how we are going to move our body to help our brain. That's the whole point of neurophysiotherapy. We'll dive deep into that as well. Cardiorespiratory, how to keep your heart healthy. If it already has a problem, what can you do with it? Like someone has a heart attack, they had one heart attack, now they are worried that it's going to happen again. And it's a very serious condition, right? If you hear someone saying that they had a heart attack, you would be concerned about them. And that's where you go to emergency room and everything. So how you prevent it to happen again and again? Is there any option apart from surgery? That's the question that most people have with it. And the last one there is pelvic health physiotherapy. So incontinence, women suffer from incontinence post-birth, lot of it, that they can't control their pee. They just has to wear pads all the time. All of those is part of pelvic physiotherapy. Man suffers from it as well, and physiotherapy helps with it while toning those muscles back up again without surgery. Because you can always have surgery and get them tighten up again, the muscles, and you would be okay. But what if you don't want a surgery? Then there is a way for you as well in physiotherapy. Okay, so now first look at the neurophysiotherapy. How does it work? Is it like just strengthening the muscle? Quite like that, but not exactly like that. So if we talk about it. So let's say we are talking about stroke. Yeah. So if you're talking about stroke, someone had a stroke and they have right side paralysis. Is that okay? So they had right side paralysis. Now the right side doesn't work. They cannot write. Their dexterity is gone. They cannot hold the pen correctly. What can happen? Now what happened in the stroke? You had a bleed inside your brain, or you had a clot inside one of the arteries in the brain that's going in. And that's where the blood supply to some part of your brain stopped completely. Now when it stopped, what happened? That part of the brain died. A simple explanation is that part died which was supplied by that artery that got blockage or got a bleed. So that part is now dead. Now that part of your brain that is on the left side is controlling your right side. Now you cannot use your right side anymore because that part is dead. So what's going to happen? Because our brain is very, very intelligent being. Because we are intelligent being, aren't we? So what brain does is it cannot heal itself. That's a limitation of brain. It can heal rest of your body, but it cannot heal itself. That's its limitation. So that's where the part of the brain that is not working, the rest of the part of the brain bit by bit start to give nerves to that area. So they are taking up the work for that area by giving new nerves, creating new nerves altogether. Instead of actually healing the part of the brain, it's actually healing through that nerves. So that part is still dead, that's gone, it's not gonna come back. But what is going to come back, it's your movement. And how that movement comes back, that's where physiotherapy comes in. To teach your body what's correct. It's like teaching a child how to move again. That's what you are going to do with it. That, okay, most people after stroke moves like this. That's like the movement, because that's the easiest pathway our brain can form despite being in stroke. That our post-stroke, afterwards, this is the movement that would be easier to generate with our rest of the brain. That's what it does. Now, to get it again doing this, instead of doing this way, we need this, right? This is normal one that we need. Or hold a pen like this instead of like that. That's what we want. So in those cases, what physiotherapy does, it targets the muscle specifically. There is electrodes involved. We are electrifying the muscle particularly, getting that nerves to work in those sense, that it works in the same muscle. For here, I would be placing electrode here, giving the shock there, and that's going to create this movement. Without this movement. Now what it's doing, it's giving signal from here to my brain, instead of my brain giving signal down, which is normally what happens. Electrical current goes from there to my biceps and I can move it. But in physio, where we put the electrode there, we are causing movement here that is giving signal to your brain that this is a correct movement. Why we are going it this way? Giving your brain an idea to create a new nerves in a formation that is going this way instead of going that way altogether. Yes. And throughout the time, when you are not able to do this movement, your muscle becomes tighter, because that's a property of muscle. Muscle gets tighter, weaker, and stretch. We have two types of muscle everywhere in our body, wherever you go. Agonist and antagonist. One muscle has tendency to become tighter, one muscle has tendency to go weaker. If anyone goes to gym, they would know that easier to do bicep curl than tricep curl. It's harder to work your tricep than your bicep. Why is it? Because your bicep is naturally made that way that it would be tighter and stronger, because you are holding things with it. That's one thing. Alongside, the tricep is made to relax. It's made to be more in stretch position, more in like helping nature of the muscle. So all of it together build up that neurophysiotherapy. And it's only the example of arm. That happens same thing with the leg. We have the particular kind of two movements that happens post-stroke, and those movements goes down. And that's why sometimes you see someone with a post-stroke, they would be in very bad shape, and you would be questioning if they would ever go back to normal. And you will see them like 2 years later, and they are moving. They are moving by themselves. They are independent. Might not be same independent as you are, but they would still be independent. They would be walking on their own, sometimes even without walking stick, they would be able to walk. It won't never look like how the normally you were moving, because the part of the brain that's dead is the one that was controlling that movement to look like that. So for them, the new movement is the new normal. That the other part that's controlling it, that's saying that this is the best I could do for you, and they just work with it, and they bit by bit, that strengthening, stretching, all of it comes into action. And that's how neurophysiotherapy comes in there. And it's a long rehab. With neuro, everything is very long. But it's very rewarding, because by the end of it, you see the result. So if you have any problem that is related to neuro, don't give up. It's a long rehab, but you will get there. I promise you will get there. And there are multiple things. Now, if you look at simple thing, like a nerve damage, that is also part of neuro. Have you ever heard that you hit your funny bone and suddenly you get electrical shock throughout your arm? That's nothing, that's a nerve damage. Now, in reality, it sounds very dangerous, right? That you got nerve damage. But our body heals it very quickly. That's why you feel it like for a friction of second and it's gone. Because nerve has 3 layers. There's the first layer, second layer, third layer. Once you damage the third layer, then there is no coming back. Then you need surgery. Then you need longer rehabs. That's happened when you go into very bad car accident and you lost your sensation and all of it. That's like the third layer. When you hit your nerve, that's like a first layer. You are just tapping it. That's all you are doing. and there is like a bit of scratch, and that scratch get healed like in 5 minutes max. Sometimes it stays with you for an hour or two, and then it's gone, because your body just heals it very quickly. So our body is quite healing. We just have to lead it to correct healing pattern. That's the main thing. And the way that I explain that how the dead part of your brain gets the nerve from the good part, that's called neural plasticity of your brain. That your brain is like a plastic. You can mold it into anything you want. As long as you have willpower to do it, that's a very important thing. If you don't have willpower to recover, the recovery would be very long and very taxing. But if you have willpower to recover, it would be even more faster, because that gives your brain signal that this needs to be done. This person is not giving up on it. They keep trying it. Do it, do it, do it. So it's just being that much resistant to it that no, I'm not giving up. So neurophysiotherapy is a lot of mental stress with it, but it works for you. If you have any question, just stop me in between. Okay, now we'll look at musculoskeletal part of it. Okay? And go for a posture. How many of you think that you have bad posture? If you just take your hand, yeah? Few of us, aren't I? Now, what if I told you most of you don't have a bad posture? Because posture is not one static thing that could be good. You cannot be in good posture for 24/7. That's not how posture is. Now, if your posture affecting rest of your body? Yes, it does. But for how long? How is it affecting your body? All of it is the main part of it, that why posture is important. Right now, my posture, can I have a mic? Right now, my posture, because I'm wearing heels, is in lordosis. That my lumbar spine is going in instead of staying neutral, which is the good posture. So heels make my posture bad, right? That's what it sounds like. But I'm not wearing heels every day. It's not affecting my posture every day. It's now and then when you wear it and your posture alters. But it's your body's capability to go back to neutral. That's the important part. That's the postural part. If my body cannot go back to normal, that's where I can say I have bad posture. If someone with Parkinson, if they are there, they have the posture where they go like this. They cannot move out of that posture. They have to move one by one to get out of it, and still their natural posture would go like this. They would just go into that stoopness of it. They wouldn't remain erect. So that inability to go erect or go in the so-called good posture is the postural problem. That's where you can say you have postural malalignment. But if you can stand up and just erect yourself, no pain. If you can sit straight without back support, keeping your back as straight as possible for 2 minutes without any discomfort, you are okay. You are not suffering from postural issue. What you are suffering from is the weakness of some particular muscles that are causing you to wanting to relax constantly, to go on to that ligamentous support constantly. Because when you are slouching, what you are doing, you are letting go of the muscles and putting all your pressure on your ligaments that goes with your spine. Each level of spine there is a ligament. So you are just stressing the ligament when you are going into the slouchness. But if you can stand up and just like be like that, you would feel okay. You wouldn't have any pain, at least till 5 minutes. After 5 minutes, you'd start to feel the pain. Yes?
That's bad, isn't it?
The ligament? It is bad. That's what I'm saying. That's a weakness problem. That is not your postural problem. That's the thing. Posture is something that you remain in despite of it. No matter how much you try, you cannot remain erect is the postural problem. What you are explaining right now is a muscular imbalance. That's a whole different issue. That your muscle are not strong enough to hold it. Some muscle are tighter. They don't want to let go for long enough. And that's why you cannot hold the posture for long enough.
So if you don't correct your muscular weakness, it can turn into a posture problem.
Yes, but that's a very long time. Because it goes into 50 or 60 years of age where your posture would start to get affected by your muscular imbalance. Till then, you would have pains now and then. That's what you would have. You would have backaches now and then. That even in your 20s, you would be suffering from some amount of back pain. That's saying that, oh, my back just hurts. Don't know why it hurts, it just hurts. And if I try to sit straight, it would hurt even more. That's what you would feel. So that is going towards your pelvis and your lumbar spine. That's where the pain is coming from. Those are being misaligned there. The muscle there are not working properly. In the body, around the pelvis, we have two chains. The anterior chain that goes like this, posterior chain that goes like this, okay? So if your quadricep and if your back muscle, they both are acting perfectly, you would remain in the particular position. If your tummy muscle, so your abs, and if your glute is working properly, you would remain in the mid posture. But if either one of those chains is hyperactive, that's where your posture would change drastically, either into anterior tilt or posterior tilt. So either you would have like a forward hip or a fully backward hip. And that is postural change, because that is not something that you would see and think that that's a bad posture. You would just see it and you would be like, yeah, that's how they walk always. But they are walking with that posture. That's a postural change. That those muscle has caused a postural change, and that too in such a coordination that you don't feel problem with it, and you just walk with it and you can just go on with your life with it, now and then having the pain. That's a bad posture. That would be a definition of bad posture. Same thing with phones, that you are like this all the time. But are you able to keep your shoulder back, or your shoulder just keep going in on you? And later on, you are feeling like they're still in. A lot of desk workers suffers from it. That's a postural change, where their head comes out. Because postural change are not painful. You have to understand that. Before the postural change happens, that's where the pain comes. So if you are in pain and you feel it's your posture, it hasn't gone to your posture yet. It's going towards it. That your posture is going to get worse if this pain does not resolve faster. Because if the pain resolves on its own without you doing anything, that means it's affecting your posture by the end of it. Because your body don't like pain. It's going to get rid of the pain. By hook or by crook, that's what the body does. And that's why it goes like that bad posture. Yeah, that's a key to actually get rid of pain. Let's get into a posture that's not painful, where the muscles are enough coordinated, but not quite there, and you can move around with that. And that's why you would see someone from the side, and their shoulder would be coming forward. Not drastically, not like this whole way, just very slightly tilt there. Just very slight tilt that you would notice there, that it's going forward there. And that small thing is affecting a lot of things. It's affecting your driving, because every time you're moving backward, your neck is being affected. Your neck doesn't have as much motion to go forward. Because when my shoulder is relaxed and down, I can go more. But when my shoulder is elevated and forward, that's where I'm restricted by it. Because your spine does not have enough space. And that's affected by stress as well. So many changes are stress related in your upper spine. If you are taking a lot of mental stress, work stress, family stress, your trapezius muscle, that would become overactive, and you would have shoulders that are going up. Or you would have a constant neck stiffness. We see a lot of patients, at least 4 or 5 patients daily, of complaining just normal neck stiffness, nothing else. That their neck feels stiff, and when you ask them to do this, they cannot do that. Their movement would be just this much. And they think that that's normal, that is the normal amount of movement they should be having. Well, the normal movement is quite low. Because we see people who cannot move them, they are pretty like just nodding it in between. And they think that's normal for them. Because they never experience the full range. Because from very young age, they are under that stress which has elevated their shoulder so much that now they have lost the movement altogether. Because right now, if you elevate your shoulder and do it, you would feel it's hard. It's hard to keep the shoulder up and moving your neck. Yes?
Are we sitting properly?
Yeah, 1 minute.
Are we sitting properly?
You are sitting properly.
Question is, are we sitting properly?
Because this, what you are telling us, is there is a need for us to start practicing it even while we are in church here.
Yeah.
So you just examine us to know whether we are sitting properly, so that from here we'll take it up.
But the thing is, you can be sitting properly right now, or I can tell you to sit properly. I can tell you how to sit properly or something. But it won't be permanent. Tomorrow you would come without knowing, you would sit how you are sitting right now. You won't change it. That's the main thing. Yes?
You spoke about shoulders, and
Yes.
I wanted to know a little bit about frozen shoulder and how that
Yes.
happens, if that's related to stress as well.
It is related to stress, it's related to diabetes. So if you have diabetes, you are more prone to frozen shoulder. If you are not using full range, then also you are prone to frozen shoulder. If you all try to just move your hand all the way up, you would feel that in the end range, there is a bit stiffness there. We all would feel it because we don't use that range. And something that you don't use, it's going to get stiffer.
I was just thinking about what Pastor Godwin said about you just showing us how to sit, because whilst we're here with each other, it will be good to do it because we see each other weekly.
Yes.
And we can support each other, I think.
Yeah, you can, definitely. The best way to sit is to have a good lumbar support. If you cannot hold your lumbar by yourself, have a pillow there. Have a pillow just above your hip there. Keep it there and just sit with your pillow. Keep trying to keep your shoulder back. So if you are like this, okay, your chin should just fall around your bone in the chest bone. That's where it should be falling. So your neck is not completely in that you're making a double chin, but it's not completely forward where there is nothing there. So just in the middle, where you have a bit of a globe and just like being there. Just perfect. That's how you do it. Yes. So that would be a good posture, where the shoulder is back, your chin is in the middle, and your lumbar spine is either supported or it would be just there, and you would be just holding it there. Because holding it there might be painful for some of you. But just having support there would still help your posture. What you can do to actually keep those changes going, and also to keep that postural change away from you, that okay, it doesn't happen. Or whenever you sit, if you don't want to think about your posture, the best thing to do is to strengthen the particular muscle. Like going this way, this muscle is tight, your back muscle is weak, because it's always one muscle is tighter, other muscle is the weaker one. So for your chest, what you can do, if it's rolling forward, you can go against the door frame, just hold it there and just go against it. Stretch your chest. Other thing, what you can do, for your back muscle, you can start to strengthen it. If you have access to gym, you can do rowing for it. If you don't have access to gym, just have a can of Bane, just go away and just do this. Just try to pull it towards your hip. Start to build up that back. At the same time, start to loosen up your chest. You can self-massage the chest around the area, and you would find knotted places, which is totally fine, nothing to worry about. That's very normal thing. A tighter muscle would have multiple knots. And now as we are already on the knots is not a literal knots of the fiber of the muscle. Because that's a misconception that how do you release the knot? How does it like opens up or something? Like a thread knot? But it's not like that. Knot is just a name they have given. Actually, that's a tension. Think of it like all of these are fiber. They four are making my muscle. Now, one of them is having tension. Now, when you palpate around it, what's going to happen is you are going to feel that there is something, and then you are moving forward. That is tension. That is the tension in one fiber, making it look like there is a knot. It's not like this. It's not like that. The knot is not this. The knot is this. One part is just high in tension compared to other. If all of you palpate around here, you would all find knots. I can bet you money on it that you would find knots there. Because nowadays we all are stressed and our trapezius are in knotted position. They always have knots. Now when those knots become painful is when they become inflamed. Then they were putting overwork on it. Now, this is a knotted muscle, okay? You are going to ask it to contract normally. That's what it would do. The knot isn't just going to move with it, okay? Now, you are putting more load on it. You are carrying something by your side and just walking. What's going to happen? It's going to full spasm. It's going into full one. Now, this part that's already in the tension is not going to work because it's not working. It's just tension build-up, nothing else. So that fiber is not going to work. Now, what has happened? You have lost one whole fiber of it. So instead of 4 fibers working and getting you that movement, only 3 fibers are working, giving you that movement. And that's where the problem comes. That's where you feel the pain on that knot because your body identifies it. Your body identifies the knot as a problem because it's not moving. Because it's there and it's useless. So that's why your body identifies it and inflammation starts there. Your body starts to attack it. That let's try to break it off. That's where the inflammation comes from. By your own body. Because you are not hitting there. No one hits you there. Why does that hurt? Out of nowhere. Because your body is attacking it. Because without injury there is no pain that comes in. There is some kind of injury happening. And most of the time when it's internal, it's your body that's attacking it. For a good cause, but it's attacking it. And then that inflammation is going to give you a lot of pain. That's where we have to release the knot. When we release the knot, it's a pressure on that knot. We put enough pressure on it that the internal structure of the muscle that would become break there, and that breakage would lead to a new generation of the muscle. And that new generated muscle is not going to have that knot in it, not going to have that tension in it. Now, 4 days later, you have same pain, same knot. What happened? What happened is the muscle wasn't strong enough. The next time you tried to hold something, the muscle went into same spasm and the other fiber went into that knotted position because it wasn't strong enough to hold it to begin with, because you had to build it up bit by bit. You were not supposed to just release it and then you are gone. Because so many people come to us, they expect a quick recovery. They come to us, they go pain-free later on. 1 week later, they are back saying that it didn't work. I went home, I was okay, and in 2-3 days, it came back again. Why did it came back? Because of lack of exercises around it. Lack of gentle activation. Now, as I said, that holding it is causing you to have that pain. Okay, I am telling you to do exercise. Isn't exercise as loading it as well? Isn't it? It's the same thing. That I exercise with holding it. You are not wrong, you are exercising it. But is the load appropriate for that or not? That's important. Because when I would give you exercise, I wouldn't give you anything in your hand. I would just ask you to do this. That would be gentle activation. Just hold your body's hand's weight and just do that. That's it. That's a gentle activation. Your muscle would start to feel better. It would move better. It would break the adhesion that has formed around it as well. The blood is moving in and out. Because blood is the best lubricant, the blood would take away the adhesion as well as inflammatory mediators, which is causing the inflammation in that muscle. And that's where, bit by bit, 4 days you did this every day, just 10 repetition, nothing too crazy. If you do 50, it's going to work it way again to the where it was before. Do 10, just be relaxed with it. After 4 days, take a can, take a bit of a weight, like 1 kg or 500 gram, based on how you can, and just do that again, just 10. Build it up bit by bit. Treat it like it's delicate, because it's your body. Why to treat it that harshly? Because it is the what carries you, that is the what takes you every day. Why you want to treat it harshly? Treat it gently, treat it with care. It's bit of strengthening, bit of stretching, all of it together. Like as we talk about the shoulder and the sitting posture, if you all stand up and do pelvic tilt, that would give you an idea how much you're more restricted, because pelvic has very gentle and very small movement. If you can't do that movement, that means your pelvic is stuck and one side of muscle is pulling on it a lot harder than the other side. So now you know, okay, I need to do stretching, I need to do strengthening. How do I do it? Because when you are sitting, what's happening is your pelvis has to rotate forward for you to sit properly on your tailbone. And then has the buttocks as a support. Instead of going directly onto your tailbone, that's how you develop coccyx pain. Where you have pain on your tailbone and you're like, no, this is not going away. That's happening because of poor posture. That is postural problem. That you stayed in that posture for a very long time, for 4 or 5 months, you did not change your posture while sitting. You were like just sitting on directly on your bone instead of your buttocks. And that lead to that pain in your bone, because bone is not made for that kind of load of the whole body, and that to directly on it. So it's going to get an inflammation. That's how the body works. But if you were sitting properly, what would happen is the load would go to your buttocks and then go to the spine and vice versa, going up normally, which is how it's designed. And now we are at the designing. How many of you have heard that don't bend your back when picking up things, or just don't bend your back in general? How many of you have heard that? Most of us, right? Okay, now all of you do this for me. Does anyone's elbow go below it? No, right? It's restricted by bone, literally, that it's not going to go downer than that. Think about your spine. Can I go forward? Is it restricted by bones or something? Or do I look like I'm in excruciating pain by just going forward or something like that? Because if you do with your thumb, you would feel some pain, it would go still. Which is wrong, but it would go, but it would be excruciating pain. With your back, you don't feel that. Then why everyone says that bending your back is such a bad thing for you? It's made for it. Your back has a joint that is going to make you go forward and backward. That's a joint's work. So why everyone says that? Anyone has an idea? No one?
Just excess movements. Strain, weight bearing needs to be considered. And your joints and the angle, straight rather than at an angle. Yeah, it's just the procedure that needs to be considered. The way we bend, the way we do it properly. Yeah.
Not really. Do you think too much when you bend your elbow or any other joint, for wrist, let's say, or hip? Do you think too much about it? Even when you bend and pick something up, do you think too much about it?
No.
You just do it, right?
Not in sports and things like that. We just
you just do it, like day-to-day life.
Yeah.
So why spine is more complicated? Because it's a joint. It can bend. I can bend this way, I can bend that way, I can go like this. So what is different for that?
Well, they'll normally tell you about bending your spine when you're picking up heavy loads. Besides picking up a heavy load, then you'll be able to bend the spine.
Exactly.
So weightlifting, or if you're in a workplace or a heavy box, then you're told to keep your back straight.
Yes. Why they are saying that? That's a question. So, okay, back can bend. We are clear on that, right? That bending a back is not a bad thing. You can bend your back. Depends on how much load you are going to put on the back. That's one factor. Second factor, how well is your core? Because it's a spinal cord that's the risky part of it. It's not the spine itself. Spine can do whatever is fine. It's a spinal cord. The disc herniation, you would have heard that the disc is slipped. That when they were bending or even just doing gardening, someone slipped disc. Things like that. Very simple things, slipping the disc. What's happening? What is the structure that is becoming so weak there that just the disc is just sleeping out of there? Because it's a good structure. Why is it doing that? Because if you are saying someone that have a spine, have just some spine to you, you use it as an insult or something like that, but you're trying to say the spine is strong. So why we are treating it so delicately when we are using it? So spinal cord, it has a lot of ligaments around it. And top of it, there is muscles. erector spinae muscle that goes around it. So if we go into the other bit, I think it's not working. Can I get a model? Can yeah, here. So if you look at just outside of the spine on that side, there is a very big muscles. Okay, very few big muscles there. Now, if those muscles is not going to hold your spine in there or not going to have a tension, as I said, when you're sitting like this, you are stressing your ligaments. Now, think about it. You are sitting like that for years and years at end. What has happened to your ligament if you keep it stretched? They are now weaker and just stretched. Nothing else. So first line of defense, gone. Your disc is at risk because you are sitting like that for the rest of your life. So your disc are at risk because the ligaments are now a lot stretched. They don't have enough space for it to be tight there. Second line of defense, your muscle. Like, how are you strengthening them? Are you strengthening them at all? So second line of defense is your muscle. If you go forward and come up using your muscle instead of just mindlessly going downward, it would be okay. Now, how to get those muscles to activate without thinking about it? If you want to do it mindlessly, how to get it done correctly that way? That's where comes your core. Now, with the core, there is a lot of myths about it being your abs. I can tell you someone who has 6 abs or 8 abs can have a weaker core. You can see their abs and they would still have very weaker core. Because core is a muscle that sits like this. And it's very deep. You cannot see it. No, until or unless you cut 3 muscles on the top, you cannot see that muscle. It's that deep because it goes around your spine. And that's where it supports it. Now, if you are laying on your back and just try to put your hand there and put down. You can do it in standing as well. Just trying to get it down without contracting your tummy too much. Okay? And just keep breathing. And if you do that, you would feel that this curve is not as exaggerated as it was before. Like even with the heels where my posture is just like getting worse with it, I can just hold my core and my spine is okay. It went out of that excessive lordosis into that middle portion. Now the heels are affecting my knee posture, which is fine because it's just going to bend it. It's not going to hurt it because knee can bend, so it's fine. But my spine would get affected by it more. So if I just work on the core, my spine is feeling a lot better. I won't suffer from low back pain going home that, oh, I should not have worn heels. That thought would not cross my head because the core is protected. Now, by daily doing the core exercise, just holding your core in, it's a very gentle exercise. You would tell someone and they would be like, it's so easy. But when you do it, you would feel that it's hard to keep breathing, not use your outer muscles and use your inner muscle to push down onto your spine. It's become a lot harder. And that's what you have to do every day at night and hold that position for 5 minutes. If you do it every day, I promise you in a month's time, you can bend your back and you won't feel any pain. You won't feel that your back is under like some kind of threat or anything like that. Because the body would protect your spine so well that you won't feel it. You can bend forward and you can do it. And if you want to load your back, you can load up till 20 kg. You can start having the weight in your hand, going down like that and coming up. Very gently, but you can start doing that exercise as well. That's called Jefferson curls if you want to YouTube it or something. So those are Jefferson curls. So you can do them as well. And bit by bit, you can go up to 20 kg holding in your hand, going down purely from your back. Because for some people with osteoarthritis, it's hard to use your knee. You cannot bend down with your knee because it's excruciating pain if you have osteoarthritis in your knee that is getting worse and you haven't gotten a knee replacement or any treatment going on or any injection or something in it. You are suffering from a lot of pain there. And then you are more limited to activity. You have to ask for help quite a lot. that's losing independence bit by bit. And that can be very sad. It could be very small thing, but it can have very big effect on your mental health. So it's better to take care of your body or take care of what you have. Make a best use of it. That's the main part of physiotherapy. We teach you how to use your body and what is remaining of it, if you have any other problem. Yes?
I wanted to ask, I think you covered some of it, was just a topic of ergonomics.
Yeah.
And just position ourselves generally. Ergonomics, and you mentioned the muscles as well. So.
Yeah, for ergonomics, I think so, if you are desk work or something like
strain,
that.
That's the other one. Repetitive strain, RSI.
Strain?
Repetitive strain.
Repetitive strain, yes.
Yeah.
Repetitive strain is the one that we were discussing before, that the ligament, that if you are sitting badly for a very long time, you are straining your ligament constantly. It's not the muscle you are straining, but it's the ligament you are straining constantly. And that repetitive strain has come as a very big strain when you are bending forward, and suddenly your disc slips. That's a repetitive strain injury. That it didn't happen overnight. It happened after years of just doing something wrong or doing something that was actually painful for you. So that's how it goes. With ergonomics, it differs from occupation to occupation. The worst one for it is actually desk workers, because they are on their desk for a very long time, which is, for most of it, is not healthy. You should be moving around every hour or two maximum. Because sitting for that longer of hours is not doing good for your hip, your joints, in general, not for any of your joints. Again, the neck. So many people don't have the eye level of the screen. They have like down. So they are working all the time like this. Now, while working like this, you are straining the shoulder, staying it in the internal rotation, not in middle, because this is internal, this is external rotations. So being in this position, leading to shoulder going up bit by bit, and that's a postural change. That you are in that posture for 7 to 8 hours every day without doing anything for that. That would lead to problem. How you solve it? First thing, get the screen to the eye level. Get it there. Okay? Do this way. Just do it. Use your laptop, you keep it as you like. But every hour or two, take a break. Take a break, just stretch your arm, bit more movement, add more movement to it. The more movement you will add to it, it would be better. Yes.
Yeah, so I have a question, because I'm listening to you and I'm trying to think now the difference between, well, I sort of know, but a lot of people tend to go to chiropractors for back pain to get cracked and readjusted and all of that stuff, you know. But later on, again, the pain might return. So I was just wondering what the benefits are of visiting a chiropractor versus physiotherapy.
Okay. First of all, nothing against chiropractor from my side, but I don't believe in chiropractor as much, because I think the joint should not be moved in that much of a range. Joint should be moved. We have grading for moving the joint. Grade 1 that we use for pain relief, just oscillating the joint. Okay? So you are just doing this with the joint. That's all you are doing. This is the 2 joint line. Think of it as your knee. I'm moving it this much. That is grade 1. This is grade 2. You are going in it a bit. Grade 3 is actually going out of it at the end of it and then coming back. So it's almost dislocating the joint and then coming back. Now, joints are not there to dislocate. When you go to chiropractor or go for that kind of activity for continuous amount of time, what happens is all the ligament and tendons around your joint become weaker and weaker. And when they become more and more weaker, you would have more chances of getting that joint misaligned. Instead of that, if you just strengthen the muscles around it, it would remain aligned. And you are not straining the ligaments around it. And the relief you get from chiropractors, sometimes it's endorphin. Because when you move your joint in such a high range, your brain releases a chemical called endorphin that suppresses the pain entirely. Because think about it. If it's going that far and coming back, it's going to hurt your joint. It's going to feel some amount of pain there. So many people experience a pain relief. Some people feel like, yeah, that's fine. Like for shoulder joint, most people would feel that shoulder feels a lot better after chiropractic. That's because shoulder is unstable joint by nature. Sometimes you would have pain in this range. And that's an indication, in a way, that your rotator cuff is trying so hard to keep your shoulder in your socket that you need to actually move your joint inside it to get your shoulder in that correct position so that it doesn't hurt as much or that it can move easily. Okay. If you do one activity, all of us, just do this with the palm outside facing. How does that feel? Okay? Not going hard enough? Okay. Yes, that's easier, right? Now turn it around, going that way. Just going like this. My bad? Yeah. Does that feel more restricted? Does it feel like something is wrong with it when it's going with the palm in? Yes, perfect. That's where it feels like it, right? Pulling, not comfortable, not smooth. Why is it doing? Because after 90 degree, your shoulder have to internally rotate outwards and then go up. If it doesn't do that, there is a restriction. So if I forcefully keep it there and go all the way with internal rotation, I'm going to feel the pinch. So now your external rotation. If this muscle that can do this is in spasm or is not working well or doesn't have strength to work anymore, or you strained it somehow, like putting something upwards, you strained it somehow, that's where this range becomes painful. Because every time you're moving in that range, that joint rotation that should happen, it's not happening because the muscle is not powerful enough to do it. You would have underarm pain. You would have like front of the shoulder pain. Sometimes pain can feel like it's radiating down. We get a lot of complaint where they think that the pain is coming toward the deltoid, a very big muscle, rarely has a problem. So that muscle, they feel like that's a problem. Yes, please.
Is on the sleeping position.
Yes.
At times I get confused. Some people will say left side, some people will say face up, some will say right side when you are sleeping. So I want you to please properly advise us which position is better for sleeping.
To be honest, whatever feels comfortable to you. That's the answer to it. Whatever feels comfortable to you. Because once you are asleep, you are going to move out of that position which I'm going to give you just like 5 minutes after it into the position that you like the best. So that's the thing. So there is no particular position. The particular position only exists if you have a problem.
Okay.
Like you have frozen shoulder on your right side. You are not going to lay on your right side. But I think that's common sense. You wouldn't lie on your painful side to begin with. That's why you want to be in pain actively. So that time we just give advice that go on to your left side, sleep that way, have like a pillow in the front, put your arm there. Make it as relaxing as possible. Because that's the main thing. To make it as relaxing. Because sleeping is supposed to be comforting and relaxing experience.
One question. Tennis elbow.
Yes.
Could you explain that and maybe what might be able to help it?
Yes, no problem. Now, tennis elbow, that's a tendon problem. That's going into a bone problem. Okay? So if we go and check it. Yeah. So here is it. Okay? Now the muscles are very long. They come directly to your bones here. Okay? This muscle that comes directly up to this bone. Okay? That's your lateral side of the bone. Okay? If you keep it at this, you would palpate there, you would find a bone there. Now that bone has an insertion there. That's where the muscle is. Now that muscle is going all the way down here, helping this movement. So all of you, just put your hand there on the near the bone, just below that, and do this. You should be able to feel something popping up, down, up, down, up, down. That's your muscle. That's a muscle that's responsible for that movement. Now think of it that you took something very heavy, or while playing tennis or something like that. The main thing tennis, because that's what it's called, tennis. So if you're constantly doing this, what are you doing? Straining your wrist constantly. The repetitive strain. This is example of it, the repetitive strain. That constantly doing this lead to that muscle going into the spasm. Now, you didn't take care of it. You didn't know that there was a spasm. What happened? That spasm is going towards that tendon where it originates. Because everything goes back to its origin. That's what it is. And that's where the tendon is. Because muscle goes up, 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 turning very small like a string and attaches to that bone. Now, every time you do this, you are straining your muscle there. You are pulling onto that area. You are pulling onto that bone particularly. That's where that bone becomes painful. Because you're pulling on it constantly. If something is getting pulled on constantly, it's gonna get inflammation, it's gonna get red. Think about it, because if you kindly tap yourself constantly, it's gonna hurt. It's gonna feel like it's bruising a bit. That's what it would feel like. That's what's happening to the bone there in tennis elbow. Now, what to do? First thing, get rid of the muscle tension. That's the first thing to do. So first thing to do is to get rid of that muscle tension. How you do it? You can self-massage it as well. You can have like a ball and just rub it all over it. If you can't find it, what you have to do? Just the movement. Find the muscle that is going there. But if you have tennis elbow, you can find the muscle very quickly. I can guarantee you would have definition of that muscle, like you just went to gym or something. You would have that definition. Just have to massage that muscle. It can be painful, just have to massage gently. Once you have done that, the muscle becomes more and more relaxed because more blood is going to the muscle. Muscle is more relaxing state. After that, gentle activation, because muscle has to go back to its function, but not completely. That's the thing. You cannot go and play tennis again. Simple logic, that you are not going to go and play tennis again the day after you got to realize that you have gotten tennis elbow. You have to take a break. At least for 2 weeks, you have to take a break from the activity that is causing it. What is the repetitive strain? That you have to find out. And if by any chance you cannot do it, like if you are a cleaner, you have to constantly do this. That's your living, okay? So you cannot stop it. And that is another reason for a tennis elbow or golfer's elbow. Could be anything by doing this movement constantly. So now what can you do? You can wear a brace. Support your elbow as much as you can, so it does not have as much strain going on to it. So it is more supported, so your tendon is not getting pulled from that muscle constantly. Because at one point, that tendon and the muscle, both of them would go into atrophy. They would start to degenerate because it's going for long enough, so it would start to degenerate. That's what we call tendinopathy, where the inflammation is resolved, there is no inflammation left, but the tendon is degenerating bit by bit. And now you have the degenerated tendon, so rehab is longer for you. The muscle is not going to work as fast as possible. And that's where you have to gently activate the muscle. So just doing this very gently. That would be your starting point, to gently move it. Now what's the different thing? This is the motion, right? Going up is the motion. So going up is concentric and going down is eccentric. That's where the muscle lengthens, but it has to have control because that's controlling it. Now what controls it? Same muscle, just going down, controlling it, going down. That is the one that you have to build more, because if you build the going down bit by bit, your tendon gets stronger. Not the muscle belly, your tendon. That would start to get better and better. And once your tendon can take more load going down without any discomfort or pain, you know you have made it, and now you can go safely back to the tennis or any activity that was causing it, and that would not be painful. And your rehab is done for tennis elbow there, because that's what it is. You have a question? Yeah. Huh? Yes, same thing. Same thing. But if it's going to shoulder, that's a different issue, because if you are going up and doing this motion constantly, you are using all of it and chain reaction to your shoulder. The strain that goes to the shoulder is leading for it to go out and in, out and in, out and in, and straining the front tendons here. So what you need to do, first this. gentle exercising. All of you can do it. It's good for shoulders. Shoulder won't have problem in future if you keep doing them. Just moving them side to side. That's one thing. Other one is like this. If it's not painful, you can go into 90 degree and do this. Bit by bit, you can add weight to it as well. That if you feel like you can do more, put weight or resistance band or anything like that. You can hold it in other hand and just do this. You can go that way as well. Yeah.
Can you feel tennis elbow in another part of your arm? For example, this part here.
Which, if you just hold it a bit high for me. You can, because it's a referred pain of it. It goes all around it, because it doesn't stay in one position. That's the thing. But that's a case for a lot of condition. Because I was talking to Tim in the car that we were discussing about it, that sometime you would have a muscle tear. You would have pain everywhere else in that area but that muscle. That's very much possible, that you would have pain everywhere but there, where the problem is. And that's where the assessment comes into action, that how the assessment is. And that's where all the movements come in, that can you do this? Can you do that? It might feel stupid when you're doing that why is she making us do this? Or why this physio is making us do that? But that's a part of assessment, letting us know which movement is causing you problem. You might not be able to go this way, but you would feel pain while doing this. You would be able to say that, I have pain when I'm doing this here. And when you do this, they would be like, it doesn't hurt, but it only goes this. No more than that. Because the muscle isn't tear. A torn muscle, your body is not allowing that range. Won't be painful, but won't allow the range. It will be just that. That's it. But this would be painful because then the muscle needs to work, because that's an accessory movement for it. So that's why it's hurting there. So you would think that everything wrong with your shoulder is with that movement, while it's entirely different thing. Most people with shoulder reports pain here, but the actual pain that they are suffering is here. So when we palpate the muscle, it's here where the pain is. They wouldn't have any pain when we poke there. No matter how much we poke there, they would not feel it. But the moment they move, they would be like, yeah, here it is. And that's where the referred pain comes in. Because the same nerve goes all around your body. If you have any problem with your diaphragm, which is a breathing muscle, you would have pain at the tip of your shoulder on the right side. So, because it's a deep muscle, it cannot hurt. You cannot have pain here. So the referred pain for it goes onto your right shoulder tip. Same thing happened with heart. Heart is a muscle. Anything goes wrong with the heart, where do you feel the pain? Left arm. Left arm start to ache. That's the angina, the whole different condition there is. Because heart is a muscle, it cannot hurt there, so that's why it directly goes in. If someone you see is clutching their heart and they are holding on to the left side like this, and someone who is holding like this, which one would you attend first? The question comes, is the one that's holding like this. Because that's heart problem. This is not heart problem, this is heartburn. They might have acidity. Yeah, but if they are holding it in the front, that's a clutch sign that says that, no, that person is having heart problem. That person needs to be seen by emergency. So there are very different signs. Our body is mysterious in its own ways. Yeah. There is explanation for everything, but it's mysterious on its own way. Any other question about posture or just in general muscles? Muscles, joints, ligaments, any condition that comes to mind?
You mentioned core muscles.
Yes.
The importance of keeping, I think again, the importance of keeping your core muscles in tune.
Yes.
And how do we go about that without going to the gym?
Yeah, that I told you already, how you can do it at home, just holding your muscle in. That's the one exercise where you keep your hand behind your back, okay? While you are laying down, both of your knee would be bent, okay? So you're in relaxed position, keeping your hand there. And then you're going to fill that gap by your tummy. You're going to push down with your tummy to go in, while keep breathing, and then hold that in. Holding that in while keep breathing would build up your core muscle. And once you start to hold it in for 5 minutes without even realizing, you have made it. Day-to-day life, your muscle won't stop doing that. You would walk with it.
I just think it's important for all of us, because we're not necessarily want to go to the gym, but we need to keep fit.
Exactly. And that's why it's very small things. If you don't have osteoarthritis, go for a walk 10 to 20 minutes every day. On road, on treadmill, wherever you can go. Because that's going to keep your knee healthy. Because your knee, the cartilage does not have blood supply of its own. It's getting all of its blood from you moving. It's a pressure joint. So every time you move, what's happening? The pressure goes in, the fluid comes out of the cartilage, and the moment your other leg takes in and the leg comes off, that's where the fluid comes in, and the fluid that comes in now has nutrition because that fluid interacts with the blood that is nutritious. So walking actually makes your knee better. If you already have osteoarthritis, then it's a different story because then you cannot walk as much as normal. But if you don't have osteoarthritis, best way to prevent it, go for a walk. Every day, 10 minutes, 15 minutes, go for a walk, and it would keep your knee and hip both very well because our joint works very well with load. Like a push-up position, that's good for your elbow, but most of the time elbow doesn't have as many problems. So it's okay, you don't have to go into push-up. And you can do it against the wall as well, just wall push-up. So there are very simple ways to treat it. And that's where, even if you don't have a problem, it's just better to go visit a physio just for preventative exercise. Just get an exercise regime that works for you. Because when you Google something or when you YouTube something, what it shows is a very generalization of it. That do this, 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 this. What I said right now is also generalization of it. That, okay, do this, 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 this. But if we take one particular person, ask them what they are suffering from, what their concerns are, and assess their posture and everything, we can build up a particular regime for them that, okay, you need this strengthening, this much, this is useless for you, don't do that. Don't go and do a chest press when you already have a posture that is causing you to go forward. Because then you are going to make your tight muscle so strong that it's going to get tighter and tighter. Have you seen bodybuilders that walks like this? And they cannot move. You look at them and they are like, can they move or not? That's the thing, because that's where the muscle gets tighter. Because this muscle is very tight, and most of the people just work their chest in the gym. So things like that, that's why you need particular regime that works for you, with your life. Sometimes we get patients who are very busy. They have maybe morning 5 minutes or 10 minutes to give it to themselves. And we work with that, okay, we'll give you exercise that is only like necessary for you. We'll remove all the other exercises, it's fine. We'll give you very necessary exercise that you can do in that 5 minutes, and that would give you just as good enough results, where the pain would be gone, and once all of it is gone, then we will go and revisit the areas that needs the work. So we would set the priority, have the proper rehab program in place. So I hope that clears it up. I think most of it should be cleared, but let's see. So here, that's what it is. The good posture is about how much strength you have, how's the coordination between the muscles are, how's your balance. Now balance could be two types. One static and one is dynamic. Static is me just standing here. That's a static. Dynamic, how am I walking? Am I walking back? That's a dynamic posture. Now, if you stand, close your eyes and you start to sway like that, that's a vestibular problem. You have to go and see your ENT for that. If you start to sway when your eyes are closed. But if your eyes are closed and there's like a bit of movement which is normal because it's a balancing itself, that's totally fine. So there are always two types of posture, balance as well. One that is like muscular, that is do with your joints and how your muscles are, and the other one due to your actual vestibular system that helps with the balance. So if you have anything like that, you have to go and see an ENT first, and then you can come back to us and we'll take care of you. So that would be it. Back posture, same thing. Some muscles are weak and they are becoming more and more stretched and tight. Maintaining balance become harder because this posture here in the picture, that's how the Parkinson's goes, like this. and then they have to take baby steps. They will be walking like this. You might have seen some people that would walk like this. They cannot take a bigger step because their body doesn't allow it. Because more than this, and they would start to fall. Because increased fall of risk happens with it. And that's the increased chance of fall that we see with the back posture most of the time. This is about lower back pain. Now, lower back pain has so many causes to it. Some of them are unknown. That's what it says as well. That most of it goes into idiopathic, mechanical low back pain. That how you were moving throughout your life has caused such a high wear and tear that now your back just hurts. But that's not true in all cases. If you do enough work around your back, it will go away. It won't go, it will go away that way. So you just have to build it up bit by bit, okay? And there's just a program that how you do it, that identify the pain and the trigger. Is it bending forward? Is it bending backward? What is causing the pain? Pain relief, that would be the first action. Electrotherapy or movement education, that goes into pain therapy. Activity modification. Till the pain is totally gone, stop the activity or find a modification of that activity. Then strengthening and stretching according to the muscle which is needed, and then return to the activity and prevent reoccurrence. That's the main part of it. A few other conditions, I think we covered all of them. Yeah. Any questions? We are covered? No worries. Thank you for being lovely audience.
Don't go. Come back. Okay. So Nelly first today, so she can get a personal thank you from me.
Thank you.
Coming down and presenting us the physiotherapy, not the mental one, the physical one. Thank you for your time, coming down, for sharing your knowledge with us, and hopefully we'll be sitting better, more upright next week. We'll all be
That's
different.
a goal, bit by bit.
People will come and thinking, what's wrong with these people?
Sitting like in military.
Thank you very much.
No problem.
And again, thank you all for coming, spending time, edifying ourselves really, because we all learned something from listening to health professionals, what's in their mind and how it all works. We're going to close now, so if I can ask you all to stand. Our Father who art in heaven, we thank you for the time again. We thank Nelly for and El Pida for their time. We thank you for the gifts that they have and the willingness to share with us. We pray that you will continue to bless them in their field of work, and that they will go from strength to strength. As we now are about to leave, we ask, Lord, that as we go our separate ways, that you will give us safe travelling mercies home. My prayer in Jesus' name. Amen.